Hi, my name is Taban. I'm a oculoplastic surgeon in Beverly Hills. I'm an assistant clinical professor at UCLA. In this video, I'll be talking to you about the causes and management of eye tearing. First, there are two categories of eye tearing, two categories of causes. One category is something is irritating your eye, and that causes irritative tearing. For example, if an eyelash is poking your eye, it's going to cause irritation, you're going to tear. The most common cause actually for irritation is dry eyes. And I'll come back to the management of this. The other category is if the tear drainage system is not working well. What is the tear drainage system? There's a gland here that makes tears, it lubricates your eyes, and the eyelids pump the tears into a little hole in each eyelid on both sides. They catch the tear, it's called the punctum. They go through a small tube called the canaliculus in the eyelid. They collect into bladder called the lacrimal sac, and the bladder empties into the nose. This is a bony duct, and the exit hole is towards the bottom of the nose. If there's blockage anywhere in this system, the tears are not going to go through. Just like in a sink, if you put a stopper in the sink, the water is going to collect. Also, if the lower lid is not functioning well, either because it's pulled down or it's floppy, called ectropion, it's not going to do a good job of pumping the tears, and the tears will also hang around. The management of tearing depends on its cause. If it's something irritative, if the lashes are turned in, you got to fix the lashes. If it's dry eyes, then you have to manage the dry eyes, either from using lubricating eye drops or many other modalities such as punctal plugs. What I want to focus on is the tear drainage issue problem. Usually this is a surgical treatment. If the lower lids are malpositioned, either because they're retracted, pulled down, or they're floppy and rolled out, called ectropion, then the eyelid needs to be placed in a more normal position using eyelid surgery. So either eyelid ectropion surgery or eyelid retraction surgery to properly restore this pumping mechanism of the tearing system. If there's a problem in the punctum, if it's narrow, then it can be dilated or cut open. One of the most common causes for blockage though is nasolacrimal duct blockage in this bony canal, which is narrow here, but in adults it can get blocked. In order to fix this, what we do is, instead of the exit hole being here, we make an exit hole above this blockage, so the tears will go from the eye into the new hole. So they're bypassing this blockage. Now, this technique is called DCR, short for dacrocystal rhinostomy. There are two main types. One is external DCR, where the incision is made on the outside in order to get to the nose. The other, more elegant approach to do this is through inside the nose. It's a scarless, stitchless operation with much quicker recovery. So that's done through inside the nose, called endonasal endoscopic DCR. The recovery for these procedures are bruising, swelling for about a week. Patient can see because we don't patch the eye, they can walk around, they can do normal activities, except we ask them not to exercise or do heavy lifting for 1 week. One other reason for blockage has to do with congenital nasolacrimal duct blockage. That is different than acquired nasolacrimal duct blockage, because in congenital what happens is the distal end, usually that hole is a membrane. This membrane doesn't open when the baby is born. At first, you monitor them and do conservative therapy. But if the problem persists after age 6 months, maximum a year, then there's a procedure to put a probe and pop that membrane open. So we talked about various causes and management of eye tearing. It's important to be evaluated by an oculoplastic specialist for determining the cause and the management.